Welcome to NYC Health and Hospitals Kings County's YouTube podcast. We have a special guest with us today, the president and CEO of LiveOnNY New York, Mr. Leonard Achan. Achan was appointed president and CEO of LiveOnNY New York in November 2021, having started his career as an ICU nurse in 1999 at Mount Sinai Hospital. He's a veteran healthcare executive with over 20 years of leadership experience. He previously started as the president at the Hospital for Special Surgery's Innovation Institute. His leadership roles have spanned clinical, operational, marketing, communications, crisis management, digital transformation, branding, and innovation, and he has served in several C-suite roles. Thank you for joining us.
Thank you for having me.
Thank you so much.
It's an honor and a pleasure to be here.
We really appreciate you being here.
We appreciate you and everything you do for the community.
Thank you. We have a few questions we're going to go through with you. Starting with the first one, how did the partnership with Kings County begin?
Sure. So great question. So we are what's called an OPO, an organ procurement organization. Mm-hmm. It is a federally designated nonprofit, and we have a designated service area. So for LiveOnNY New York, that means the 5 boroughs, Nassau and Suffolk County, Westchester, Lower Hudson Valley, and an area of Pennsylvania, actually, Pike County. And what that means is we're responsible for the 13 million lives and over 100 hospitals, of which New York City Health and Hospitals, Kings County is one of our collaborators, one of our hospitals, and one of our donor hospitals, mm-hmm. which in the pyramid and the hierarchy of the most important things in the world, mm-hmm. that is the most important thing in the world. The donor hospital that treats our community and that works with our donors to give the most precious gift of life back to our community.
I understand you started your career as a nurse. What did you learn during that role that you still use today?
Sure. So I am a medical ICU nurse. So started my career there. I'm a nurse practitioner, but went into administration after about 3 years bedside in the ICU. And the ICU is where the sickest patients go. The ICU is also where the majority of our donors for organ and tissue donation come from. And it was an unbelievable career and unorthodox career trajectory that I had. But as a nurse, I'll tell you what I learned that's applicable to today. Mm-hmm. What I learned is that there's not enough awareness, not enough education, not enough knowledge about the organ and tissue donation process. I know that, self-reflecting, because I was completely ignorant of it. Through my training, even through my 20-year history of serving in 11 different roles, of serving through several C-suite roles, of serving across 2 academic medical centers. In our academic training, in our clinical and practical training, from awareness, I was actually on the other side of the table. Mm-hmm. I was that nurse where when the organ procurement organization walked in, I had my 2 patients, one who may have passed away and was a donor, and one who I needed to still keep alive. My priority was the person that I was still trying to keep alive because no one ever told me that that donor could save 8 people's lives. Mm-hmm. Right? And I know better now. So, when I think back to my history, when I think back to my entire career, and when I think to what I'm doing now, the word that comes into mind is almost ashamed. Mm. So when this role presented itself, and when I thought about it, and when I realized the history as an academic, as an educator, as a nurse, as an executive leader in New York, born and raised, with all the urban legends and everything to go with it, mm-hmm. I said, you know what? I actually know how to fix that problem. I know because I was on the other side of the table. Right. I know where the landmines are. I know where the Achilles tendon is. I know where the ignorance lies. Mm-hmm. How could I go and do something to make that better? So that's where I connect the beginning of my voyage to where I am today.
Wow. Why did you want to leave the bedside?
Yeah, great. I'm often asked that question ever since I did, quote unquote, leave bedside. I've never left my patients, mm-hmm. right? So I'm still a nurse. I'm a nurse practitioner. Through and through, I've served community from the moment that I entered a hospital to today. If you looked at it on a graph, what you'd see is that as a nurse, I had 2 patients and as many as 12. Mm-hmm. As a manager, I had 100. Mm-hmm. As a director, I had 1,000. As a VP, I had thousands. Stepping up into communications and branding and awareness and social and digital, I was able to reach millions, right? So when you think about it, not in title or not in where you are, when you think about it as what was the influence that you were able to have to impact lives, mm-hmm. that's how I look at it. I look at it as never leaving my patients, but instead being given the opportunity and being blessed enough to step up to help more people And when I say I didn't really do anything. I waved my hands and hired people way smarter than me. I drew pictures. I recruited talent. When I say I'm talking about probably dozens of people, if not hundreds of people, who brought me to where I am. But yeah, I never left bedside.
What drew you to organ donation?
I was called by a recruiter. And again, completely ignorant of the world of organ donation, minus obviously the experience I had over being in the healthcare ecosystem. But when I spoke to that recruiter, I looked at a website and I watched a video, and I saw a donor family speaking, and I hit the X, and I shut that website off because it ripped my heart out. And I said no, shut it down, walked into the kitchen, and I said to my wife, I'm in a lot of trouble. And I said, because something just hit me so hard that I shut it off. And then I went back, watched it again, and ended up on what was supposed to be a 20-minute call to help that recruiter find the next CEO. And it ended up a 2-hour call and me going through that process. And coming out of COVID, I think that we all have sensed mortality in a different way, whether in healthcare or not, whether we're clinicians or administrators, executives, politicians. We've all realized and normalized the conversation around mortality. And I think that wanting to give back to community and put an X factor on that and create a force multiplier for it is what pulled me in to be able to give back to community in this way. It's a different way to do it. And the beauty of it is, with an organ donor, it's a 1-to-8 ratio, right? It's a 1-to-8 ratio. With a tissue donor, it could be a 1-to-75 to 100 people that's impacted. So making those administrative decisions, contributing to help increase what our community has given this precious gift to others to help them live on, being able to do that was an unbelievable opportunity and a righteous mission that I couldn't look away from.
Wow. What motivates you to work hard?
Wow. What motivates me to work hard? I think there's just a work ethic instilled. I'm the son of immigrants who migrated here from the West Indies. Watching my parents work hard, I think that's one thing. I'm purpose and passion driven. So knowing that if I just don't waste my calories and expend every calorie that I can to help somebody surrounding a bed today, hoping for a gift and praying for a miracle for their loved one tomorrow, if I could increase the likelihood of that happening to people who may never meet me, see my team, or know how it happened, I think that's what drives me, and that's what's always driven me. Yeah.
Who inspires you?
I'm a Christian. Jesus inspires me. Okay. That's about it. My father, who's not with us anymore, was an unbelievable person. But ultimately, it's God that inspires me.
So your team that you mentioned earlier, they work 24/7 to save and change lives through organ and tissue donation. How do you motivate them?
You have to lead. You have to lead. And, and I've talked a lot about this, but being a manager, being an administrator, being an executive, and being a leader, those are 4 completely different things, right? You could lead from behind. You could lead in any role you have, but being a leader, right, requires presence. It requires passion and rigor and discipline, and people understanding that every decision we make and everything that we do is impacting our families, communities, and lives. That's the great motivator. I think that if I've done anything, I've simply self-reflected, communicated, and made sure that everybody remains aware of that. And it's not a hard thing to do because we have an unbelievable staff at LiveOnNY, right? So I think it's the other way around. I think the staff motivates me to continue to lead, and maybe there's a recycling going on there where then I can motivate them through my actions.
Is there anything else you would like to share with us? Any important stats as the CEO and president? I know you come across quite a bit of data.
Yeah, sure. So, here's the thing with, and speaking from both sides of the table, from somebody who was not in this world a year ago and who is in it, deeply now in the trenches. There are 100,000 people on the wait list in the United States, over 100,000. But there are millions heading to that wait list. So this isn't just about transplantation, it's about diabetes, kidney disease, GI disease, pulmonary disease, heart disease. It's about all of those diseases that can get you there, right? Now let's talk about our community. In New York, there's a little over 8,000 people who woke up this morning hoping that they have a chance to live on through transplantation. We have a lot of work to do, so I don't mean anything that I'm about to say is any compliment or pat on the back, because we have so much to do, and we won't rest until that wait list is zero. But in the first 6 months of 2022, we've broken all New York City and New York State records for organs transplanted, which is lives saved, for the amount of donors, and for the amount of tissue donors. Another critical stat there is another urban legend people think about New York, which isn't true, but our 9 transplant hospitals are donor hospitals, and the reason we're here is our donor hospitals who care for our donor community, period. Our donor community that give this gift through our donor hospitals is why we're here. We know that with over 100,000 people waiting for the gift of life in the United States and 8,000 plus New Yorkers who woke up this morning waiting for that phone call, that miracle, we know there's a lot to do. And we know that we are not going to stop until the wait list is a zero wait list. But I want to share some stats with you because of the generosity of our community. And they deserve to hear this, and they deserve a thank you. In 2022, in the first 6 months of 2022, we've increased the amount of organs transplanted by 40%, the amount of donors by 33%, and the amount of tissue donors by about 33%. We've broken all of the New York City and New York State records. Which is great, but again, I say that with caution because there are so many people still waiting and we have so much more to do. The other thing that's very important to know is in the first 3 months of the year, Q1, greater than 65% of organ recipients here in downstate New York were non-white recipients, the complete opposite of what many may think across the U.S. We've increased organ donation in our Black and Hispanic communities. We're continuing to educate and engage as much as we can, and we are heading in the right direction, but 2022 will be another record-breaking year. We will exceed our numbers from 2021 and save more lives through organ and tissue donation than ever before. So we won't stop, and we want to tell the community thank you, because that's only possible because of their generosity. Not me, not anybody else. Only their generosity, and our donor hospitals, like New York City Health and Hospitals, Kings County, make that possible. So thank you.
Thank you so much, Lenny, for joining us here today and sharing
welcome.
this information with us. Any final words you'd like to say?
Now, please register to be a donor and think very simply about what you would want for yourself. Thank you.
Thank you.